PSI is a nonprofit organization based in Washington, D.C. that harnesses the private sector to address health problems in more than 60 developing countries. With programs in malaria, reproductive health, child survival, and HIV, PSI promotes products, services, and healthy behavior that enable low-income and vulnerable people to lead healthier lives. Products and services are sold at subsidized prices rather than given away in order to motivate commercial sector involvement. PSI is the leading nonprofit social marketing organization in the world.
Kusile, good morning and welcome back. It's a Tuesday today, the 7th of July 2009, and on attachment with the Population Services International PSI, I do have Mr. Neal Piper, who is coming from Pfizer. He has been employed by Pfizer since 2003. He's actually the therapeutic specialty representative there, and he'll be telling us exactly his mission in Swaziland. Neal, good morning and welcome to Kusile Breakfast Show.
Good morning. Thank you for having me on today's program. It's an honor to be here.
Neal, first, I have spoken about the fact that you're coming from Pfizer. You're currently attached to PSI. Your background, where exactly are you coming from?
Well, as you mentioned, I'm from Atlanta, Georgia in the U.S., and I work with Pfizer in their sales division. And at Pfizer, we have a program called the Global Health Fellows Program. Now, this program, it sends fellows, such as myself, out to go work with different nonprofit organizations, such as PSI, to do two things: to build the professional or the transfer the professional skills they've taught us at Pfizer, and to build capacity in order to address the healthcare issues that take place in different countries. So I'm here on behalf of Pfizer as a sales and marketing advisor for PSI.
What exactly do you want to achieve after your 6 months in Swaziland attached to PSI?
Well, in terms of the healthcare industry, sales numbers or sales trends are an important indicator of health impact. And, for us here, my biggest goal, number one, was to work with the sales team. Coming from a sales background, is to train the sales team here at PSI professional selling skills. So we had multiple stages of training: business plan training, we created sales aids, and as well the steps to a sale. And the reason that's important is because our sales representatives go out all to the high-risk outlets, bars, shebeens, spazas, and what they're doing differently now is they're actually sending a message teaching people what the HIV rate is, and now the owners of these stores, the bars, the shebeens, are now sharing with the people they know the importance of using protection so they can prevent HIV. So that was number one goal. Number two is to help with the distribution of PSI's maternal and child health products, WaterGuard and Worm Free. Currently, you probably know this, is 80% of illness in Swaziland can be traced to unsafe water, and claims 1 out of 10 children who die under the age of 5. WaterGuard is a water purification product that helps stop this preventable death.
What exactly have you achieved so far? You've been here for about, is it a month already?
About 2 or 3 months so far.
2 or 3 months. So what exactly have you achieved in the 3 months?
A couple of achievements that we've had is we've partnered with a few organizations, Ministry of Health and World Vision, to distribute 1.2 million WaterGuard tablets. As you know, there's a big cholera outbreak taking place in the Big Bend area. 16 confirmed cases, 1 confirmed death. And the Ministry of Health is responding quickly to this epidemic, and PSI wanted to respond quickly as well. We gave 250,000 tablets to the Ministry of Health to provide 5,000 people safe water for the next 2 years. As well, last Friday you saw we did a partnership with World Vision, and in this partnership we gave them 1 million WaterGuard tablets and this is going to provide 35,000 people, vulnerable children, people living with HIV, safe water for the next 2 years through their area development program and their neighborhood care points. Secondly, I think in terms of deworming, we were working with the Ministry of Health last week. We went to a school with 700 children and gave education about deworming and dewormed all the children. We're looking for partners now to help with our product Worm Free, which costs $2.50 Imiligani, 2.50 per tablet, and only needs to be taken once every 6 months. And then lastly, the sales team, they're becoming much more streamlined, much more efficient in what they're doing. Sales numbers are up 125% since coming in, and I think a lot of that can be attributed to the sales and marketing team at PSI, the job they're doing there. What we're doing is getting people's opinions here on New Start, which is voluntary counseling and testing for HIV, and we're just getting the opinions of the people here at this football match here in one of the local villages in Swaziland. Our internal personal communication team is doing a talk on the importance of testing for HIV. A new study shows that 42% of people here now have HIV, so it's so important that PSI for what they're doing to make sure to prevent the disease from spreading.
Wathi ngesimo sakho kunedindlela utigwemako empilweni yakho. Ngingabatshela nje nya. Lapha nje ngiyashona la nje ngibatshela ukuthi mina sengiphuma khona. Futhi sengiphuma khona ngingasacala. Lokuthi nje solo ngifuna kwathi ngesimo sami. Solo ngifuna kwathi ngesimo sami.
Swaziland was put on the spot during the Love Test campaign, which was shown on CNN. I want to find out exactly what your role was with that clip being shown on CNN.
Yeah, sure. Thank you. It's it was a really fun day when we found out that CNN was going to put coverage of the Love Test campaign, and it's a lot to you guys part at Swazi TV. I know you guys did a big coverage at the event in Manzini, and you know, when the journalist called Dominique, who's our marketing director, to write an article on this, we were just completely stoked. When we made this, my job, I have a passion in photography and video, and my job simply was to kind of make a short documentary of the event. The PSI team did a great job putting this thing together. And through this documentary, CNN decided to put it on their website, and they ran a ticker across international news to go to their website. And you can go there now. If you go to CNN.com, type in Swaziland Love Test, and you can see the video and the write-up of what PSI is doing with its partners to help HIV here in Swaziland.
Neal, thank you so much. It was quite an honor to have you on Kusile Breakfast Show.
Thank you so much. It's a pleasure to be here.
That is Neal Piper, who is coming from Pfizer. He is the therapeutic specialty representative currently attached to Population Services International, or PSI.
How are you?
Hey, how are you?
How are you? I'm fine.
What? Can you see yourself? Now you can see yourself. Bye-bye. Bye-bye.
PSI measures its effect on disease and death much like a for-profit measures its profits. In 2006, PSI estimates that its programs directly prevented more than 250,000 HIV infections, 6.7 million unintended pregnancies, more than 140,000 child deaths from malaria and diarrhea, and 34 million malaria episodes.